Hello, my name is Emily Heater, and today we are going to discuss techniques to calm, upset, or agitated patients. This is an important topic as workplace violence affects every country and healthcare setting, as 4% of the global employee population has experienced physical violence. Nurses are at all times greater risk for violence than any other profession. Ariza, Montez, Muniz, Montero, Simo, and Araki Padilla. Violence is not a unitary phenomenon. It takes many different forms. McGuire, 2008. It is important that healthcare workers know how to handle violent patients and know the warning signs before those patients become violent. Gaines, Brown, Lux, et al. Describe aggressive behavior as actual physical violence towards self, others, or property, or making specific imminent verbal threats. It is important to implement steps early to prevent the patient from becoming further upset or agitated, which can lead to violent behaviors. Nurses can really have an impact on the way that we handle these kinds of situations. Wieland, Ivory, and Hutton state that there are 4 non-pharmacological interventions for acute behavior disturbances, which are environment modifications, policies, practice change, and interventions. This is really important to note because education regarding how to handle these kinds of patients and situations is really important. It is important to practice and be knowledgeable on how to handle this situation. It is important to note because we are members of the medical care team, we need to maintain a safe working environment as well as being prepared and educated to handle escalating behaviors. The strategy that we are going to talk about is utilizing verbal de-escalation techniques when dealing with an upset or agitated patient. Verbal de-escalation techniques are easy to learn and implement. Verbal de-escalation takes no more than 5 or 10 minutes to implement. Richmond, 2013. Some of the techniques for verbal de-escalations are listen to the patient, distraction, redirection, you change the subject, provide options or choices, and empathize with the patient. When interacting with the patient, body language comes into play. It is important that you do not make any quick movements or your posture is non-threatening. It is also important that you can provide them with adequate personal space and maintain a safe distance so the individual cannot swing at you or grab at you. It is important also to monitor the sound of your voice, speak slowly and in a controlled voice. Most of all, it is important to remain calm and watch the patient for nonverbal cues to see if the techniques that you are using are working or not. Make sure to always ask for help and rely on your other nurses. We are here to help each other. It is important to note that the same technique may not work for every patient. The same way, and is verbal de-escalation techniques to assisting them in calming down. So it can be important to implement different techniques for every person because everybody's different. Verbal de-escalation techniques are a great method to first try to de-escalate a situation before it can develop into a violent situation. It does not require any pharmacological interventions, chemical restraints, or actual physical restraints. It allows the individual to maintain integrity and provide a safe and alternative option for the patient. We are going to implement the verbal de-escalation technique training to all employees within this facility. We are to set up 3 available time slots for next week so that everyone should be able to attend at least 1 training session. At the session, we will have an interactive session in which we will have you role play both as the nurse and as the patient. That way you can practice both of these skills. It is important that you know and understand what each person is going through and how they're feeling. You will be evaluated by myself to make sure that you have a knowledgeable and training session needed to handle yourself when you are in this difficult situation with a patient. We will continue to offer monthly sessions to keep you up on your skills and provide handouts as well as utilizing nursing interventions to de-escalate an upset or agitated patient. This is an important topic and it is of utmost importance to keep our staff and our patients safe. I appreciate all of you for taking the time for coming in today and listening to my presentation. I hope to see all of you at the training sessions next week. Thanks. Have a great day.